At Georgetown, in any given year, we have over 700 students engaged in intercollegiate athletics. These young people are among our country's most talented athletes and some of our most committed students who see the opportunity to participate in intercollegiate athletics as a vital aspect of their work of formation. As I have shared with you over these past few months, our highest priority has been the health and safety of our community. Since the fall, we have been following our plan for a gradual and incremental return to campus, guided by our public health program and the current conditions of the pandemic. We have focused on returning different elements of campus life. We have resumed research in our laboratories while managing density. We have returned seniors and some additional students to campus residence halls. We have developed hybrid learning opportunities for undergraduate and graduate students. We began holding some small-scale religious services in person. And we began a phased return of some of our sports teams. Our teams participate in a national intercollegiate context. Each school has to be responsive to NCAA guidelines, individual leagues for different sports, as well as their local conditions. All of these then factor into the public health programs developed by each school, and then ultimately the decisions about how each team can proceed. For us, we began with a pilot last fall, returning our women's and men's basketball teams, as we established an entirely new set of protocols around public health. We monitored this closely. Both of these teams had to grapple with a pause in their seasons due to COVID. And over the fall, we built and expanded our public health program as we prepared to return more members of our community back, including some additional teams. Our lacrosse, soccer, and our track and cross-country teams for both women and men have returned, as well as some additional teams over the past month as they prepare for more limited seasons, tournaments, and championship events, or the opportunity to formally practice together as a team. We have worked to create an incremental approach responsive to specific circumstances facing each team, recognizing that we are not in a position to fully bring back all of our teams. These are the most difficult decisions. I wish to express my gratitude to our colleagues in our athletics department, our public health advisory group, our coaches, doctors, trainers, and everyone who is working with our teams and our students during this time. They have worked tirelessly over these past months, and I'm deeply grateful to them. I also wish to recognize our students and your families. We know that your participation in intercollegiate athletics is a result of your deep commitment, your resilience, hard work, and dedication over the course of many years. We understand how difficult this year has been for you. To describe more of what this work has entailed, I've asked three of our colleagues from our athletics department to join us today. Lee Reed, our Francis X. Rienzo Director of Intercollegiate Athletics, Dr. Corey Hudson, our team physician at Georgetown, and an associate professor in our Department of Emergency Medicine at MedStar Georgetown University Hospital and MedStar Washington Hospital Center. Dr. Hudson also serves on the medical team for the Washington Wizards and the Washington Capitals. And Sean Hendy, our Associate Athletic Director for Student Athlete Health and Wellness here at Georgetown. Lee, Corey, and Sean, thank you for joining us for this conversation. Let's get started.
Lee, I want to turn to you first as we open our conversation. How would you describe the approach we've taken this past year to prioritize the health and safety of our students engaged in intercollegiate athletics?
Thanks for the question, Jack. I think from the very beginning, we wanted to first make sure when the pandemic began back in March that we got our student athletes home to their permanent residences safely, made sure they were okay, and then as a department, we sort of took the lead of the university, your leadership and the public health group to put safety first, health and safety first, and so we formed a working group within the athletics department, and it was essential for us to make sure everybody understood that every decision we made moving forward would be guided by the best medical advice that we could get. So therefore, I put Sean Hendy and Dr. Hudson and Dr. Hankey in charge of our group to ensure that we were being guided by that really good medical information. So we started with that, and we sort of have made every decision since then based on that. We've let the science guide us. We've worked in hand with public health. We wanted to be assured that we were aligned with the university in our approach to that. And so that's why you've seen us sort of add back intercollegiate athletics and varsity sports like the university has done in an incremental way to ensure that as we took each step, we made sure our protocols worked. We made sure that the things we thought we could do safely, that we could do safely. And then we took the information we learned, and I'll let Dr. Hudson and Sean really go into the detail because they led all of this. But we wanted to make sure that everything we had put in place, that it worked. And then we took the next step. And so I'm really proud of our approach as a university. I'm proud of our approach as an athletics department. A lot of credit goes to, again, Sean and Dr. Hudson and Dr. Hankey, because it has been, as you know, this has been evolving as we've gone through this entire 10, 11 months, now a year, and we continue to take the same strategy moving forward. So for us, it was incremental. It was trying to get with a goal of trying to get all of our student athletes back to some level of activity this year. And I'm really excited that that plan has worked so far. So yeah, everything was led by our public health group and by Sean and Dr. Hudson.
Thank you, Lee. Thank you very much. And Corey and Sean, for those less familiar with your roles, could you provide us a sense of the team that we have in place? And could I invite each of you to briefly describe what you and your colleagues are focused on day to day in supporting our students? How have you seen this work change over the past year?
Thanks, President DeJoy. Yeah, so I'm charged with the oversight of the sports medicine department, which includes 12 full-time athletic trainers, 4 incredible team physicians, including Dr. Hudson, who's on this call, an embedded clinical sports psychologist, an embedded sports dietitian, and numerous consultants who are all deeply committed to the physical, mental, nutritional well-being for each member of our athletic department. We do have 750 student athletes that we take care of as our own, and Dr. Hudson has been instrumental in leading the COVID policies and procedures. So I'll turn it over to her.
Thanks, Sean. I think the thing I'd like to add here is that we've got a really wonderful partnership between MedStar and the university and the athletic department. So from a physician side, we all split our time between clinical duties in the hospital and in the outpatient clinics and in the athletic department. And that's given us an opportunity to work with the infectious disease specialists and the cardiologists and the pulmonologists and all of the specialists that we have in the region to really bring the best evidence to this discussion on an evolving basis. So as we learned more, we were able to modify our policies and procedures so that we were always on the cutting edge and we were always able to provide the best medical care available to our student athletes any day of the week for the last year.
If we dive just a little bit deeper, Corey and Sean, what are the most critical aspects of health and safety for our students who are engaged in intercollegiate athletics? Could you talk about some of the health and safety guidelines that have been necessary for us to put in place?
Sure. I mean, I think in any year, the health and safety protocols that are in place, and especially at a school like Georgetown University, one of the things that attracted me was the paramount, commitment to physical, mental, nutritional, all the well-beings that we talk about, the cura personalis and the mission of the university that way. Obviously, COVID has complicated those things. We've had to evolve as much as our policies and procedures that have evolved, so is our delivery of medical care. And I think that's where we've evolved most, telehealth being one of them. We use different software applications and suites to deliver medical care now that we otherwise would have done in person. Dr. Hudson can speak to the injury clinics and illness clinics that we have during the year. That would be 30 people deep in the training room at all days of the week. We just aren't able to do that with social distancing in place now. But we've come a long way since last March to deliver high quality medical care to each one of our student athletes.
I think Sean's point is well taken. I think the key here is that we need to make sure we're adhering to all the public health principles that we know are really critical for reduction or elimination of transmission of disease. So making sure that everyone is masked as much as possible, enforcing social distancing, making sure we do good hand hygiene every opportunity we have. And the biggest impact on what we do day to day is a reduced density of people that we can have in any of our spaces, including the weight room, including our athletic training space. And this has really given us an opportunity to get creative, as Sean mentioned, with telehealth, with different forms of triage, that we can provide health services for athletes even before they return to the university, when they're at home, be that in Ohio or Florida or California. When they get back to campus, we can see them any day, really any hour of the day. We can get on a telehealth visit and we can do a face-to-face, do a rapid assessment and decide, does this athlete need to go to the health center? Do they need to go to an urgent care or to the emergency department? We can make those decisions in real time. And for injuries, things that don't involve illness, we get them into the athletic training room on a scheduled basis so that we're not increasing our density, but making sure we still deliver those optimal physician services, athletic training services, physical therapy, all of our usual services, just in a more scheduled and slightly more controlled way. And through it all, it's been important to make sure that while COVID is obviously at the front of our minds, we can't ignore the fact that concussions still happen and musculoskeletal injuries still happen. So we have to be at the top of our game in managing all the things we always managed with our student athletes, and then the added layer of infectious disease and infection prevention on top of that.
And Lee, what have we learned as we have incrementally brought back additional teams?
Well, Jack, I'm really proud of our response to the last year and all that our community has had to go through. I think we learned that in a crisis situation, our community can meet these challenges, and we can do so in a way that aligns with our mission and the values of our university. I'm proud of the professionals we work with. I'm proud of how our student athletes have become leaders in this in terms of wearing masks, social distancing, adhering to the policies that were in place. I'm proud of how we've taken the slower approach to getting our student athletes back in a very safe way, because that was the overall goal. The overarching goal in all of this was to keep our community safe, not just our student athletes, our coaches, our staff, the frontline workers at Georgetown University, our faculty, and certainly the Georgetown community. It was everybody was in this together, and we wanted to make sure that we kept things in perspective. As much as we wanted to play and be back on the fields and the courts and the pools, the most important thing was the health and safety of everybody in our community. And so I think that's what we learned, that we can come together, we can achieve that, and we will come out of this better than we went into it.
Thank you very much, Lee. And I'd like to close by asking each of you to share a moment or an idea that has guided you or helped you to stay focused during this extremely challenging period. And we'll start with Sean, go to Corey, and then we'll conclude with Lee. Sean?
Sure. Thank you, President DeGioia. I mean, I think the idea that has guided me is simply realizing that after, almost 25 years of doing this job, 13 of them at Georgetown, how important athletics is in a student athlete's formation. The sports medicine department here operates in an evidence-based, physician-driven decision-making environment. We've lived that through the past year more than ever. We strive to provide a holistic care for each one of our student athletes, aligning with the university's mission of Cura Personalis. The physical, emotional, mental, and nutritional well-being of all of our members of teams drives us each day. And we can't wait for the day that all of our student athletes and staff are back on campus in a normal operating environment. Those things are not lost on us, how important athletics is in the formation of these young men and women, and how much that affects, their daily living as individuals, and what that means for the future. So nobody, is more passionate about it than Lee Reed, than all of our medical professionals that are working here. And our livelihoods are based in that formation as well.
Thank you. Thank you, Sean. Corey?
So I'll go a slightly different direction. And as I mentioned earlier, I split my time between the hospital and athletics. And I've been at Georgetown since 2006. And I'll say that one of the most profound moments for me is in the emergency department, taking care of dozens of patients with COVID. And we have such a vulnerable population that we treat at the hospital, including a number of transplant patients, including a number of cancer patients who are very vulnerable, including some patients who come from our most vulnerable wards of the city and the areas around. And I remember taking care of a patient who I've seen over the years since I started at Georgetown, intermittently in and out of the emergency department, in and out of the hospital. And this patient came in very, very ill and told me that their mother was in the intensive care unit and their father had passed away the week before. And I admitted that patient, who then died the next day. And so I think what has been most profound for me is knowing that everything we've done as a university and everything we've done as an athletic department, as Lee said, is not just about us. It's really about our involvement and our deep commitment to the community, to the people around us, to the people who've been profoundly affected by this pandemic, and recognizing that while athletics is very important in the formation and in the health and well-being of our student athletes, that we're still keeping an eye on that larger community and our part in it. And so I was so proud to see last week when the Student Health Center started their vaccination efforts. And I really felt like that was the moment where we've come full circle here, and we're taking care of the community and the people that we share it.
Oh, thank you very much, Corey. And you're referring to the vaccine clinic we ran last weekend through our colleagues in student health, right in Ward 8 here in Washington. And it was a very, very powerful moment for our community to really contribute to getting the vaccine to the places where it's most needed. So thank you. And thank you very much for your exceptional leadership in our community. And let's conclude with Lee.
Jack, when the moment this became even more real, I think to me and to all of us, was when I heard that Patrick Ewing, our very own Coach Ewing, had come down with the virus, and his struggles through getting back to being healthy, that the impact that had on him, and being able to sort of witness that firsthand. This virus has touched all of us. And we were all pleased and excited that he was able to come out of that, and then serve as sort of a spokesperson to our community for, look what I went through and look how this does impact you. And so that made it really serious for us. And so proud that, again, our community has come through this together, and I think we're stronger for it. And we're grateful to be here at Georgetown, to work at a place with colleagues who believe in the same things that we believe in, which is caring for, as Sean has mentioned several times, the Cura Personalis. It really did come to life during this last year. And we're just grateful to be a part of the Georgetown community.
Well, thank you, Lee. And thank you, Corey. And thank you, Sean. We could not ask for colleagues more committed to our students, to their health and well-being. And I'm grateful to each of you for the leadership that you have provided in this moment, and how you have continued to care and support our students during this very challenging time. Thank you for being a part of this today.
Thank you.
Thank you.
Thank you again for joining us for this weekly conversation. I look forward to being with you all again next week. Take care of yourselves and take care of everyone around you. For every Hoya, everywhere.